You would be surprised as just changing these things, how far this goes with your patients. And oftentimes, your patients aren't doing this already. And there is a growing body of evidence showing that BPA is associated with obesity. So, again, we're discussing the different environmental chemicals and where they're coming from and how it's related, and then its relationship to obesity. BPA, this is found in many plastics, epoxy resins. This is present in our everyday food containers, water pipes, our toys, our medical tubing. The main exposure route here is going to be dietary ingestion, especially when it's stored in food or in heated plastic. So just think of all of the times that your patients may be going to the grocery store and they're getting pre-made meals, and guess what that pre-made meal is in? It is in plastic, and then it's heated in plastic. Not only is BPA, that's one of the chemicals that is being leached into the food, other chemicals are being leached into the food as well. And the other chemical that we're looking at is BPP. This has been shown to also increase the production of fat. So let's do a quick review on sex hormones and cholesterol. And then we are going to talk about how these chemicals kind of impact this pathway here. We see cholesterol on the top left. There is a translocation across the mitochondria membrane, and this is by the star protein that you see on the circle, that orange circle there. From there, the cholesterol is converted into pregnenolone, and then it is cleaved by the enzyme CYP11A1 shown there. Then pregnenolone is synthesized, or the synthesis of pregnenolone is crucial because it acts as the primary precursor for all steroid hormones in the body, including estrogen, testosterone, even stress hormones like cortisol. So let's take a look at how things like BPA exposure, BPP, that is something that is the other aspect of BPA, that when you're getting a lot of plastics, you often see BPA, not BPA free, but you're not seeing a lot of BPP free. BPP is another, this is another chronic exposure that we're seeing with these chemicals and these products as well. What things like BPA and BPP are doing is the exposure is leading to the downregulation of that star protein that I showed you earlier, right? And if it's down regulating that, this is going to hinder the transport of cholesterol in and the conversion of pregnenolone. Therefore, it is going to impair our normal function of our hormones from the hypothalamus to the pituitary to the gonadal axis. And it is also going to it's also going to have us hold on to that cholesterol in the tissue as well. And so this is going to impact things like our estrogen levels, our testosterone, and our stress hormones like cortisol. And we now know from our previous weeks that imbalances in our hormones, including our sex hormones and our adrenal hormones, can be a major contributing factor to weight imbalances. So, investigating endocrine disruptors and exposure to toxicants and chemicals really should be a part of your investigation. And then these are the references here. Now, let's take another look at the mechanisms around BPA and how it causes obesity. This is another path that occurs. This picture is from the environmental toxicology and pharmacology. You can see that in the liver, BPA increases gluconeogenesis. This is also going to increase the release of glucose in the bloodstream. It's going to reduce insulin sensitivity, and it's going to increase the synthesis of cholesterol. And where is cholesterol stored? It's usually stored in adipose tissue. And this is going to cause more inflammation. And this is another vicious cycle that occurs. So not only do you want to look at the metabolism or the blood sugar imbalances, right? Like the insulin, possibly the type 2 diabetes, cholesterol levels. But what is the primary cause for that elevated cholesterol level? What is that primary cause of the insulin and blood sugar imbalances, right? One of the causes that we can look into is going to be endocrine disruptors such as BPA and other environmental toxicants. We are seeing that BPA is leading to excess fat accumulation and it promoting weight gain. Here we can see three mechanisms that lead to the same metabolic issue: reduction in insulin secretion in the pancreas, inflammation that increases insulin resistance, reduction in glucose uptake in the muscles. Here we want to discuss lipogenesis and cholesterol. Lipogenesis is the anabolic process by which simple sugars together with glycerol are converted to fats. Lipogenesis is a process that converts glucose to triglycerides by first breaking down glucose into the 3-acetyl-CoA that you're seeing there. Then fatty acid synthesis combines the glycerol as the backbone with the 3-acetyl-CoAs to form triglyceride. And the triglycerides are then stored in the adipose tissue. Now here, what it's showing is that ectopic fat obesity is a type of obesity where fat builds up in specific organs and tissues like the liver, muscle, and pancreas. It's a major risk factor for cardiovascular disease and type 2 diabetes and all of the different conditions and risk factors that are associated with those conditions. These are the references for that. The last mechanism that we want to take a look at is the adipose tissue. BPA is going to lead to the increased secretion of leptin, and we now know, as previously mentioned, that chronically elevated levels of leptin are not only associated with leptin resistance and increased hunger, but it also promotes systemic inflammation. And then it is also going to exacerbate your patients from holding on to that adipose tissue, leading to more obesity. And again, this is starting to be a chronic vicious cycle that occurs. High leptin levels is another place that you want to assess. And then from there, another cause of high leptin levels is going to be BPA or other environmental exposures. This slide is talking about BPA in the body. It was found in urine samples of nearly all people tested worldwide. The active BPA is also detected in our serum, our breast milk, our patient's breast milk, the placenta. It shows potential for a body accumulation. It can build up in the fat tissue, and it's detected in 50% of breast adipose samples globally. Structurally, this is similar to synthetic estrogen, allowing it to disrupt hormone pathways, leading to estrogenic cancers, leading to estrogenic conditions as well. BPA, now we're seeing that it is the estrogenic endocrine disruptor with adverse health effects. It is going to impair our reproductive systems and our fat cell function. There was a meta-analysis that was conducted around 4,800 participants, found BPA levels positively correlated with obesity risk. And the dose response was every 1 nanogram per milliliter increase in BPA raised obesity risk by 11%. So the first thing is you need to look at their environment. You want to ensure it's BPA-free products. You want to educate them about reading labels, avoiding heat or storing foods found in plastic. This is releasing BPA into the foods along with other chemicals. Avoid canned food, especially the ones unless they specifically state BPA free. Cook from fresh, frozen, or dried ingredients. Focus on fresh whole foods, especially fruits and vegetables. Using alternatives such as glass, porcelain, or stainless steel containers for hot foods and liquids instead of the plastic containers. You would be surprised as just changing these things, how far this goes with your patients. And oftentimes, your patients aren't doing this already. You can go through, you could probably even think yourself of all of the different plastics that you encounter on a day-to-day basis, right? Look, think about the food you ate today. Was it in a plastic container or was it in a glass container, right? If you're in a glass container, you're already on a different level than many of your patients. But many of them will be eating from plastic containers or pre-made foods from plastic containers as well. The other thing is going to ensure that they have daily bowel movement, so that should be on your intake form. Then you're going to support healthy detoxification in phase two, and we're going to show you different ways to do that. Bifido and Lactobacillus casei has been shown to reduce BPA intestinal absorption and increase excretion in the feces. But the thing is, you want to ensure that they're having those bowel movements, right? So it's not continuously circulating in their body. Silymarin or milk thistle, it has been really great if to help not only with the liver detoxifying, but it's also been shown to help with insulin resistance and type 2 diabetes. So these are going to be really great for your patients that you have exposure to endocrine disruptors. Those endocrine disruptors are causing things like the metabolic changes in their insulin and their blood sugar irregularities, leading to the obesity. Silymarin can handle all three of those aspects for them. Now let's talk about silymarin, milk thistle, and what you want to do for dosing. Start with 420 milligrams per day, 3 times a day for 68 weeks, right? This is going to help with the detoxification phase. It's going to allow the detoxification through the liver, and then through the digestive system and excreting it through the bowel movements. So again, you want to ensure that they're having bowel movements or it's going to recirculate in their body. And fiber can help with that, as well as looking into their gut health, why they might be having constipation, right? So again, going back to the gut microbiome, things along those lines, you want to look at everything holistically, how everything is connected, and ensuring that everything is optimized for them. And then once you're done with the 68 weeks, you're going to go on a maintenance dose at 280 milligrams per day. And it's also been shown to help with blood sugar and insulin. And then you can also do 420 milligrams 1 to 4 times per day for 12 weeks. That is for immune modulation. And if you are suspecting that your patients are also having a different immune response, right? They may have an autoimmune condition. Then silymarin may help with that because it can help with being immune modulating. And then 420 milligrams 4 times a day for 12 weeks is beneficial for that. And silymarin, as we understand, is really beneficial for phase two detoxification, and other compounds such as glutathione plays a role in phase two detoxification as well because it's going to directly bind to those toxic molecules, and then it's going to be made ready to be excreted from the body. And that is primarily occurring around in the liver, and then it's facilitated by that enzyme that you see right there, the glutathione S transferase.